China becomes the most untrusted country throughout the globe. Here, Wuhan being the world's first CCP hotspot on the 23rd of January, as per official reports. But is it occurred really on the 23rd of January or before? Officially China reported to WHO on the 8th of December, but now China claims the patient zero, with a 55-year-old man from Hubei province on the 17th of November. In reality, on the 8th of December, Wuhan witnessed COVID-19 epidemic after SARS, which killed 774 people in 2003, but China government convinced WHO through their strong allies. Critics say the WHO has been too trusting of the Chinese government, which initially tried to conceal the outbreak in Wuhan. Others have faulted the organization and its leader, Dr. Tedros Adhanom Ghebreyesus, for moving too slowly and declaring a global health emergency. From December onwards, China starts reporting fake numbers in COVID-19 cases. It was done under influence of Chinese President Xi Jinping, as on the 1st of January, the actual case numbers including symptomatic and asymptomatic patients were 60,000. It was reported by Chinese news site, Tencent, and journals reported by NGO from Taiwan. Here the data collected mainly from Hubei and Wuhan health officials, through NGO and journalists who don't wish to share name. It was rising until the president made another health council meeting in Beijing with health officials from Wuhan, Beijing and Hubei. On the 28th of January, government urged the official authority of Hubei to offer free cremation for the corpses of COVID-19 cases, since the Wuhan itself witnessed more than 20,000 deaths. By the 1st of February, the government took forceful measures to cover up the news. They started removing news reports, tweets within minutes it's uploaded by user and kept the social networks apps like WeChat under date decryption to know about users and their activity. On the 1st of February on 11:39 p.m., the cases reported by Chinese news site Tencent were 154,023 confirmed cases, with 24,589 deaths. But by immediate measures of Chinese government, it was rewritten as 14,446 confirmed cases, with 304 deaths, and put media restriction as to release of any data related to COVID-19 cases, only by Chinese government. Arrest of Dr. Li is not only to cover up the new disease, also about the numbers associated with it. By February last, the COVID-19 cases reached 2 million in China, with more than 48,000 deaths. On the 1st of March, President Xi Jinping visited Beijing with officials of Wuhan and Hubei province to change the criteria for diagnosing CCP cases. As China's single policy in cover with fake data, criteria changed as one can be counted as CCP case if have symptoms. Otherwise the patient is not counted. Thus China ruled out 43,000 asymptomatic cases from official number and forced the private hospitals to start reporting as other types of pneumonia instead of COVID cases to keep their patients number zero. And some hospitals refused to admit patients and manhandled the bystanders and patients with the help of police and security. Evidence was deleted soon it was uploaded by Chinese government but managed to retrieve it. Finally, CIA managed to find out the real numbers about COVID cases and death counts in China and was sent to White House. The latest report to bust the Chinese numbers is from New Tang Dynasty Television, which quoted an industrialist who argued that China has ordered a large number of body bags, a non-porous bag designed to contain a human body, especially in cases of viral diseases like COVID-19. As per the report, China has ordered 2 large body bags from Taiwan, according to a Taiwanese funeral home director. The director claims the last time he received such a huge order was after the South China Sea tsunami. The company was forced to reveal the details due to pressure from international agencies and Taiwan government itself. As of the 5th of April 2020, the statistical proportion reveals that there are 7,055,000 cases, including symptomatic and asymptomatic, with 125,000 deaths. Now, the daily number of cases are not counting by the health officials and hospitals to keep their COVID-19 patients record zero. But still daily death due to COVID-19 itself is 38 to 50. But government took strict measures to contain the news within their hands, and plans to open wet market and widen the wildlife marketing following the release of lockdown in Wuhan and Hubei province.